Thanks for coming today. My name's Caitlin and I'm going to be your chair for this morning's session. And I'm really excited to introduce Francis Hollander, who is our international guest speaker from the Netherlands. And she's going to be speaking to you today about how to maximise nutrition in CF. So I'm very excited to hear her presentation. So Francis Hollander has been working as a dietitian in adult patient care at the University Medical Centre of Utrecht in the Netherlands since 1987. She is involved in the CF Centre where about 200 adult patients are treated, both before and after lung transplantation. Besides patient care, she's interested in evidence-based dietetics. She likes presenting nutritional issues related to CF at the European Cystic Fibrosis Conference. Her first publication was in the Journal of an American Dietetic Association in April 2005, and recently she has contributed to the Journal of Cystic Fibrosis in 2014. She also participates in the Dutch Adult CF Dietitian Specialist Group. She is very dedicated in dietetic care to her CF patients and wants to provide the best nutritional outcome for them. So if everyone can put their hands together and welcome Francis Hollander today. Thank you.
Good morning, everyone. Thank you, Caitlin, for the nice introduction. I'm Francis, and I work as a dietitian, and I would like to present and discuss the latest news on nutrition in outcome to cystic fibrosis. Okay. This is the content of my presentation. For having an interactive meeting, you are all invited to participate in a quiz during this presentation. And first I will explain what an optimal nutritional status in CF is, and then I will discuss what is new on nutrition in cystic fibrosis. At the end there will be a take-home message, and maybe there is some time to answer any questions. So, I would like to challenge you all to participate in a quiz during this presentation. On your chair you see a form with 8 different questions, and during this presentation I will give information on the different subjects, and you can answer the right answer, yes or no. And at the end there may be some winner, so I wish you good luck. To start with the first question of the quiz, is weight the most important element for assessing the nutritional status? Is the answer yes or no? In literature, an optimal nutritional status in CF is explained as a BMI of 23 in adult males and 22 in adult females. For those who do not exactly know what a BMI is, it's an abbreviation of body mass index, and I will explain it in the next slide. For children, it's important that they reach a weight for length stature at or above 50th percentile if they have an age below 2 years. It is recommended for children and adolescents to reach BMI at or above the 50th percentile if they are aged 2 to 20 years old. And why is an optimal nutritional status important? It is important because it improves survival and well-being. And if BMI is deteriorating, also decline of lung function occurs and reduction of body mass index is seen, and these unwanted outcomes need to be prevented. This slide shows the calculation of body mass index, and as you can see, you can use weight in kilogram and divide it by height in meters squared. On the picture you see the normal BMI, and that is a range between 80.5 and 24.9. If you have a BMI below 80.5, you have underweight. And if you have a BMI above 25, you have overweight. And also in CF patients, there are patients who have obesity, and then you have a BMI of 30. And also there are patients with morbid obesity, and that is a BMI above 40. I will show you two examples of persons with normal BMI. First, a male, 25 years old. His weight is 70 kilogram and his height is 1.75 meter. His BMI is 22.9. And a female, 23 years old. Her weight is 64 kilos, her height 1.70 meter, and her BMI is 22.1. In children, body mass index for age percentiles are used to monitor normal growth in children with cystic fibrosis. Also in children, it is important to use accurate weight and length measurements, and these can be used to determine the BMI. The CF Foundation reported that BMI should be at or above the 50th percentile for children, and as you can see, this is the dark green line in the green area. Normal growth can also be based on target height, and then the height of the mother and the father are included. And it's important for children to have a BMI within the green area. Please notice that BMI values for children can differ from BMI values from adults to be normal, because as you can see, a 10-year-old boy with a BMI of 18 would be in the healthy weight category, but when you are an adult male and you have a BMI of 18, you have underweight. The same in a 10-year-old boy with a BMI of 23, this would be in the obese category, but when you are an adult male with a BMI of 23, you have a normal BMI. I would like to thank to Chris Smith, who's a senior CF pediatric dietitian who works in Brighton in the United Kingdom, for his help making this slide. He's also the chair of our European nutrition group. How can we reach an optimal nutritional outcome? Does anybody know one of the factors that can influence that outcome? Diet, exactly. Other factors? Exercise. Yes, great. Vitamins. Yes, great, also. Other suggestions? Sorry? Behavior about food, how to eat. Okay, yes. You mentioned very good suggestions. I will add them in this figure and they will be discussed in the next slides. So, these are the factors I will talk about. The enriched diet, the CF-related diabetes and obesity, the physical activity, the enzyme therapy, the vitamins and minerals, the probiotics, superfoods, and maybe more. So, to start with the enriched diet, question 2 of the quiz. Is an enriched diet needed for all persons with cystic fibrosis? Is the answer yes or no? You can think about it and fill it on your form. When we're looking at enriched diet, in literature, European and American guidelines differ. The last publication of Stallings shows that a recommendation of 110 to 200% is needed with estimated average requirement for energy in persons with cystic fibrosis. So a higher amount of calories compared to persons without cystic fibrosis. To obtain that enriched food, you can use oral nutritional support to your diet, and it can be used additional to your diet or in times when you are very ill as replacement of the meal. And when you use oral nutritional support and your nutritional status is declining, it's important to use enteral tube feeding, abbreviated ETF, and this can also be additional use to your diet or as replacement of the nutritional intake. And in the last decade, this is more pronounced using percutaneous endoscopic gastrostomy feeding tubes, as you can see in this picture. Looking in literature, there are some interesting publications in the Journal of Cystic Fibrosis. And the first one is of my colleague Willy Woestenenk. She has done a systematic review, and she has reported that oral nutritional support and behavior intervention, these effects are not consistent on improvement of nutritional status, but enteral tube feeding is an effective method to improve your nutritional status. And Alison Morton et al. Had performed a Cochrane database systematic review, and they also reported that ETF is effective to improve your nutritional status, but dietitians and doctors should take into account a positive balance between benefit and burden for each individual who needs that ETF. When you need ETF, but you decline it, you can see that deterioration of lung function occurs and failure to engage or to achieve a normal BMI. And this is published by Helen White et al., and this is especially in adult patients with cystic fibrosis. So, I will continue with cystic fibrosis-related diabetes and obesity. What is new on these items? But first the question. Question 3 of the quiz. Is drinking apple juice a problem when you have CFRD and obesity or not? Think about that and fill in your form. When we're looking at the recommendations for cystic fibrosis-related diabetes, the American Diabetic Association had a publication in 2010, and more recently, Australian Standards of Care for Cystic Fibrosis-related diabetes are published by Middleton. And the goal of the treatment should be to achieve a hemoglobin H1C less than 7% or 53 millimoles per liter. When we're looking at the diet, it's important to look at the carbohydrates. And carbohydrates can influence your blood glucose level, and especially refined sugars can increase the blood glucose levels. When you're looking at soft juices and fruit juices, they contain a lot of carbohydrates, the refined sugars, and they can influence your blood glucose levels. So they are not for free use. Besides dietary treatment in CFOD, also treatment with insulin is warranted. And in our center, we often use this system with the combination of continuous glucose monitoring system and a continuous subcutaneous insulin infusion. And maybe there are some people already use that system or are familiar with it. No one of you? No? Okay. What's new on obesity? Also, obesity occurs in cystic fibrosis. And 2 publications has pronounced the prevalence of overweight and obesity in patients with cystic fibrosis, and that it is increasing. And it is with estimates ranging from 10% in the UK to 80.4% in Canada. And also in Australia it occurs, we heard this morning. A higher BMI is associated with improvements in lung function, although the lung function benefit of increasing one's BMI above 25 is small. So it is not a goal to achieve a BMI that is higher than 25. You have no improvement of your lung function. And more recently, a study in 228 children with cystic fibrosis by Hannah also described that overweight and obesity are not associated with improvements of lung function. So, the third item, physical activity, also mentioned by you. What's new on that? Looking at the publication of Rand et al., they described that exercise is a part of routine cystic fibrosis therapeutic regime, and it should be used as a medicine in cystic fibrosis. It should always also be individually tailored and monitored. And there's a correlation between aerobic fitness and survival, and the reduction of decline in lung function and improvements of quality of life scores. It's also important in end-stage CF to preserve muscle mass, and I would like to show you a movie of a patient of mine who has been on a lung transplant waiting list for 9 months and stayed in our center to wait for his lung transplant. and is doing his daily exercise. Oh, sorry. Question 4. Is protein necessary to improve your muscle mass? Is the answer yes or no? When we're looking at nutrition, body composition and protein, there are several publications, and an interesting publication is of Susanna King, an Australian dietitian, and she has described that lung disease severity is poorly detected by BMI, but better associated with muscle mass. So it's also important to look at muscle mass in cystic fibrosis and not only in BMI. There's also evidence that protein is important to increase your muscle mass and to prevent muscle loss. And there are 2 interesting publications on that. And the most recently is that of Van Engelen in 2014. And there are also some evidence that essential amino acids may be helpful to improve your muscle mass. And these essential amino acids are isoleucine, leucine and valine. And these cannot be synthesized by humans themselves. So you have to use them by your diet. But there's more research needed on that issue. But do you know sources of protein when you're eating? Do you know what you have to eat to increase your protein intake? Do you know sources of protein? Meat, yes. Eggs. Sorry? Not so many in vegetables. Nuts, yes. Cheese, milk, great. These are the products that contains a lot of proteins to your diet. So yogurt, cheese, nuts, chicken, fish and meat. So be aware that you eat that during your daily meal. So I would like to continue with enzyme therapy. Question 5. Should enzymes always be taken before a meal? Is the answer yes or no? When we're looking what's new on enzyme therapy, you can see that the last decade there have been development in high doses lipase capsules, ranging from 10,000 international units to 40,000 international units. And these enzymes should be taken before a meal, what contains fat, or fat-containing snack, or fat-containing beverage. And I've been to the European CF conference in Brussels this year, in June, and there was an interesting poster that with the use of ivacaftor, some patients use less or no enzyme supplementation, and they improved their nutritional status and had a better fat absorption. So if you use ivacaftor, it may be necessary to look at the amounts that you use. Maybe they can be reduced. Also, an enteral feeding inline cartridge was shown, as you can see in the slide and on the picture. Then lipase units are used additional to the enteral tube feeding, but unfortunately this is not applicable in clinical practice yet, but maybe in the future. So vitamins and minerals also said. Question 6. Is only supplementation of fat-soluble vitamins recommended in CF? Is the answer yes or no? Looking at vitamins, There have been multivitamin capsules, and the most important one is Aquadex. And although this contains a lot of vitamins, also low serums of vitamin D remain to occur, and therefore the absorption of these vitamins should be encouraged and be enhanced to take them with pancreatic enzyme therapy and with fat-containing drink or foods. It's also important to monitor minerals to improve health outcome, and these minerals in CF are especially iron, calcium, sodium and zinc. And a study of Van Beverley showed that in patients who had low serum of zinc levels and were administered for 1 year of supplementation, they improved nutritional status, they improved nutritional intake, they were shown as having less pulmonary infections and a halt in lung function degradation. So zinc is an important mineral. Probiotics. This is a somewhat difficult subject. Question 7. Can the use of probiotics help to reduce diarrhea during or after an antibiotic treatment? Is the answer yes or no? Probiotics are defined as live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So a very difficult definition. And there are several probiotics, and the two who are important or may have a role of importance in cystic fibrosis are Lactobacillus rhamnosus golden and Gorbach, abbreviated LGG, and Lactobacillus reuteri, abbreviated LR. And on this slide you see some food products containing these Lactobacillus LGG or reuteri. This slide shows a figure of a publication of Lee et al. In a Clinical Nutrition. I'm aware that it's a somewhat difficult slide, and you can see the interaction of probiotics on the gut microbiota and its influence on respiratory microbiota. And to summarize, in CF you have changes in the intestinal microbiota, and it will increase intestinal inflammation. And this intestinal inflammation will also occur in lung inflammation. If you want to read more about this, you can download this paper, and it shows the potential for dietary treatment and significance of the gut microbiota in cystic fibrosis. In June this year, there was also a presentation of Dr. Bruno Hauser at Brussels, and he is an expert on probiotics, and he has done a review on studies with probiotics, and you can see the effects of the use of LGG and Lactobacillus reuteri. And as you can see, the effects of LGG are shown. You have positive effect on restoration of the gut microbiota, a reduction in intestinal inflammation, a reduction in pulmonary exacerbation, improvement in lung function, and improvement in gastrointestinal health. There is no significant improvement of general well-being, and there is positive effect on a reduction in hospitalization. Although a mandatory for general use of probiotics in cystic fibrosis is needed, proven efficiency in bigger and designed clinical trials and proven to be safety. So if you want to use probiotics, it's the best to have a consultation with your gastroenterologist or with your dietitian. Superfoods. Question 8, the last question of the quiz. So, is it recommended to use superfoods if you have CF? Is the answer yes or no? These slides show different kinds of superfoods. There are also different definitions on superfoods. The Oxford Dictionary defines superfoods as a nutrient-rich food considered to be especially beneficial for health and well-being. In 2007, in the European Union, the marketing of products as superfoods is prohibited unless accompanied by health claims and credible scientific research. So I have made a summary of the most important superfoods with their health claims. So you can see the wheatgrass, the seaweed, the hemp seed, the joyi berries, chia, coconut oil, maca, quinoa, raw cacao and spirulina. But you also see at the health claims that some things are not recommended, might help, can contribute. So unfortunately there is not enough evidence yet that they be effective in persons without CF and in persons with CF. So to conclude, there is no evidence on nutritional outcome in CF, and there is no literature or randomized clinical trials in CF yet on superfoods. So, did I forget something? Yes, I forgot fish oil, but it's a right answer. Did I forget something else? No? Have you read about curcumin and genistein? Okay, I will talk about these new aspects on nutrition. First, the curcumin and genistein. These products can be used, and in our center, combined with the CF Center in Rotterdam, a double-blind placebo-controlled study is started in patients older than 6 years with a genotype mutation S1251N to look at their effect on nutritional status and lung function. So we have to wait for 3 years for the outcome, but then we know more about the effectiveness of curcumin and genistein. And when looking at fish oil, what you said, unfortunately there is no evidence, no significant biochemical and clinical improvement of CF after the use of fish oil. So you do not need to use that additionally to your diet. And there are 2 other aspects. First, there is an interesting paper recently published in a nutritional clinical practice in June this year, and it summarizes the nutritional management of CF, and I think it's very readable, so if you're interested you can read it. And at the European CF conference in Brussels, there was a preview of Wilansky, who is a member of the new nutritional guidelines for CF, and they will be published end of this year. And he stated out that recommendations for energy should be 110 to 200% of the estimated average requirement for persons with cystic fibrosis, and at every 6 months dietary review is advised with a check to the adherence to the diet, and annual screening for CFRD is warranted, especially when you are older than 10 years, and with adequate treatment with insulin, and there also be provided an advice on zinc supplementation. So, I've told you a lot. I hope that you can all summarize this. I've made a summarize and I have a conclusion. So, looking at enriched diet, it can be used, but is not used, or can be used, but is not necessary for all patients with cystic fibrosis. Cystic fibrosis-related diabetes and obesity are items more interesting and should be treated adequately. Physical activity is important in different stages of the disease, and enzyme therapy is needed when you are pancreatic insufficient and are used to absorb your fat and your fat-soluble vitamins. Despite of the additional vitamins and minerals, there can be low serum levels of some of the minerals, so be aware of that. These should be adjusted. And with the probiotic use, it's important to consultate a gastroenterologist or dietitian before you use it. There's no evidence on the use of superfoods or fish oil yet, and research on curcumin and genistein is started, so we have to wait for the outcome on that. So, nutrition in cystic fibrosis, facts or fiction? I can say that facts, yes, there are, and fiction also, until proof is provided. And my take-home message for you is to use a healthy, personalized diet and to take care for daily exercise. Don't forget your medication and use the help of a multidisciplinary CF team for your optimal treatment. So, and now finally, who's the winner of the quiz? I would like to discuss it together with you. I ask you the question and I would like to hear the answer for you. So the first question, is weight the most important element for assessing nutritional status? Is the answer yes or no? What is the answer, the right answer? No? Who says no? Raise your hand, please. Who says yes? Quite, you're all right. It's important to use your weight, but it's also important to look at height and to body composition. So, no is the right answer. Okay. The second question. Is an enriched diet needed for all persons with CF? What is the answer? Yes or no? Yes? No? And can you comment on this? Exactly. So they can have a normal growth and a normal weight. So they do not have to eat a lot of calories and to preserve obesity. Yes? You have the right answer. So it is no. Okay. The third question. Drinking apple juice is no problem when you have CFRD and obesity. Is the answer yes or no? No? Is it a problem? It can be a problem. Yeah. And why can it be a problem? Refined sugars. And they contain kilocalories. So when you have obesity, you have to reduce your calorie intake. Okay. So the answer is no. Fourth question. Is protein necessary to improve your muscle mass? I think it's a yes. Okay. And should enzymes always be taken before a meal? Yes. And sorry? When you during the meals, when you use oral nutritional support with fat, or you use enteral tube feeding, it's also needed. Yeah. And is only supplementation of fat soluble vitamins recommended in CF? Yes? Who thinks yes? Raise your hand. Only one? Who thinks no? And what is the answer to that? Why is it no? Yes, minerals are also important. Sometimes people do not use a lot of milk or cheese. Then you have to look at calcium and also what I told you about zinc supplementation or iron. So you have to look at your blood levels or check it with your dietitian or your doctor if they are normal, and if they are not normal, they should be adjusted. So the answer is no. The seventh question, can the use of probiotics help to reduce diarrhea during or after an antibiotic treatment?
Yes.
Yes. Okay. But you have also asked your gastroenterologist or your dietitian if it's safe to use it. And the last question, is it recommended to use superfoods if you have CF? No, yes, who thinks no? And why? No evidence yet. Okay, great. Now, yeah.
The study that you're doing regarding the curcumin, is it?
Yeah.
Along with genocide.
Yeah.
What is it that you're thinking you might find?
It's not a study that I perform, but it's in our center, and they hope that they can find improvement of lung function and improvement of nutritional status with the use of that. Yeah. I would like to ask who thinks he's the winner of the quiz. Who has the right answers for all questions? You? Yes? The only one? Great. This you can come forward. Big applause. Hi. What's your name?
Can
Can you tell me something what you are, who you are?
I'm a mum of a little girl who's 3, nearly 4. We live in Brisbane.
Okay.
What else would you
And you know a lot about nutrition.
know?
I'm
learning.
Yeah,
I'm learning.
Okay, very good. I have a prize from the Netherlands. They have been in my suitcase for 2 weeks. My intention was to bring some delicacies from the Netherlands, but due to custom regulations, it was not allowed. So there are some food consumption related prizes. So you may choose between the placemats with some typical Dutch design or cup to drink. Yes?
Yes.
Okay.
Thank you. Thank you very much.
Is there also someone who has 7 questions right? Please count. Yes, you? Come forward. You are the second best, so I have also a prize for you. Please applause to the second best. Hi. What's your name? And who are you? The audience, would you like that?
Yes,
Yeah.
I'm Anne, of course. I have a granddaughter that has cystic fibrosis, and that's why I'm here just
Yeah. To learn about
to
it.
learn. Yeah.
And you have learned a lot?
Yes.
Would you like to have a placement?
Thank you. That's lovely. Thank you.
I have made some boxes for pancreatic enzymes. If you are interested, you can come forward and to take one of these. I have only 7 of them, so you have to be fast. Okay? Now I think there's now time to do the questions. I have some time, I think. Yeah. I would like to acknowledge my CF members of our team at the CF Center in our center, and also Dr. Bruno Hauser and Chris Smith. And I think there's now time to answer questions. Yes, over there. Yeah?
Well, firstly, thank you for presenting such an evidence-based talk, because often we get just told high fat, high salt, so I'm very grateful for such a great presentation, empirically based, so thank you for that. I just wanted to ask, with CF food and high fat food, a lot of it does contain a lot of sugar.
Mm-hmm.
Does children eating food with high fat and high sugar in it impact on CF, their predisposition to getting CF-related diabetes, or is it a different mechanism altogether?
That's an interesting question. I think it's important that you should be aware that when you eat a lot of sugars, that is not good for your health. And it can increase the incidence of CFRD. So I think you should be aware of that. Yeah. Another question? Yes? Awesome.
I was just wondering if you have a point of view on glutathione. I know there was a big, out of the States years ago, there was a kind of, that was the topic nutritionally amongst parents and a small group of doctors out of Utah. And I just wondered, they'd found that a lot of CF patients had low glutathione levels, whether that was just a consequence of or whether that was something deeper. Have you ever heard or come across anything that sparked your interest on glutathione?
Do you know something about that?
There's some emerging evidence on glutathione. So I'm a paediatric dietitian. I'm a paediatric dietitian at Monash Children's Hospital in Victoria, and there is some emerging evidence, but the evidence isn't strong enough and robust enough for us to actually recommend it to patients. But
When you say emerging, do you mean recently, the last year or two?
yeah,
Is
yeah,
that coming out of?
mostly the States. Yeah.
That's
So-
quite old, this early research, so it is coming back.
Yeah, absolutely. And as part of, so we're currently reviewing our cystic fibrosis nutrition guidelines at the moment. So the last edition was in 2006, and there's a group of dietitians currently reviewing that evidence, and I'm the section leader for that topic at the moment. I'm not yet up to, I haven't read the articles yet, but yeah, watch this space. So hopefully early next year we'll be able to have some statements on whether we would recommend glutathione and probiotics and omega and curcumin, etc. So watch this space.
Other questions or comments? No?
Sorry, not wanting to hold the questions. In one of your slides, you said that behaviour therapy wasn't that consistent in increasing nutritional status. What did you mean by that?
It is a review from my colleague who has looked at different studies, and they looked at the outcome of the behavior intervention, the use of oral nutritional support and ETF, and there was not enough evidence that behavioral interventions have positive effect on better outcome in nutritional status. Okay. Another question at the back?
I had a quick question about probiotics and antibiotics. Because a lot of the CF kids or CFers are on antibiotics for a long stage of time, when you have probiotics, is there a timing as far as can you take probiotics not at the exact same time as antibiotic, but say within an hour, a couple of hours period from an antibiotic, so that you're not actually crossing them over, so that your probiotic and your antibiotic are acting, can they act in conjunction with one another, I guess is my question.
I know that in our center sometimes patients use the probiotics when they have their antibiotic treatment. So then you can look if your diarrhea is decreasing. And some patients say that they are helpful, and other ones say they have no effect. So I do not know if Caitlin has another. Oh.
Do you recommend a particular time for how long you should take probiotics?
Now I know that when you use 2 weeks probiotics, you can look if your diarrhea is decreasing, and when it's not changing, you do not have to use it more weeks. So 2 weeks will be enough. That's
Do you recommend probiotics be taken 1 hour, 2 hours, 3 hours after antibiotic dose? Do you have a recommendation?
No, we have not a scientific recommendation, but we use it combined. So, yeah.
So I think the general advice is that we would recommend a couple of hours at least in between the antibiotic dose and the probiotic dose.
I'm not sure that I need the microphone. I'm working with Caitlin on the alternative therapies. My name's Paul. I'm a dietitian from Perth. And both valid points, but just to clarify, when you're in hospital with cystic fibrosis with an exacerbation and you're having antibiotics and they sometimes need to be at different times of the day, different antibiotics at different times, different doses, and then you've got meal times. So there's probably no evidence that says that an antibiotic is better at a different time than the probiotic. However, there is some evidence that a probiotic is more effective if taken with food or with fibre. So for the lack of more direct evidence, I would say take the probiotic with the food. If it's not contraindicated, if there's no harm, then it won't hurt and it may help. It's inexpensive. You may feel better. And then after the antibiotics is stopped, I would recommend taking it for a couple of weeks to repopulate the normal flora of the colon. And no. So the antibiotic may reduce the effect of the probiotic because not the other way around. Probiotics, the definition that Francis gave us is that they are beneficial microorganisms. So the whole concept is that the broad spectrum antibiotic is reducing the population of all bacteria, targeting those in the lungs. Some of the collateral damage is in the gut where the good bacteria population is reduced, which can cause antibiotic-associated diarrhoea. So having a probiotic is a healthy, beneficial, good bacteria that is a normal resident of the colon. So having them won't reduce the effect of antibiotics.
I'm not very familiar with the probiotics, so
Sorry.
maybe you can answer the question.
What was the question?
I was asking, I was saying that probiotics should be. I was wondering whether you're saying that probiotics should just be used when having antibiotics, or should we have it as a daily part of our treatment, so the other drugs that we're giving would give probiotics as well?
I think that it's not for daily use. It's my opinion. But maybe it's different in Australia.
We've just finished reviewing the evidence on probiotics, and I can't tell you what our recommendation will be as yet. It's not been signed off, but I think essentially we can't recommend it for routine or daily targeted use at this stage. But I think as clinicians, it would be fair to say that most of us are recommending probiotics, particularly during antibiotic treatment. Would you agree with that, Paul?
I think so.
Yeah.
And after the antibiotic course is finished, then you've had maybe a couple of weeks of probiotics just to build it back up again. Then for cost and burden of treatment, I would probably say that you don't need it.
Yeah.
But I would continue yogurts.
Yeah.
And dairy products, fermented dairy products that are just a normal part of a healthy diet that contain probiotics and fibre as a part of the diet.
Yeah, so I think Paul's absolutely right. Because they're quite expensive, it would be irresponsible of us at this stage with the evidence that we have to say every person with CF needs to have probiotics every single day. That's a very burdensome and expensive treatment regime. But I think we can definitely say yes with antibiotics and after your course of antibiotics. And then, as Paul said, use your foods that are available in your supermarket that are supplemented with lower levels of probiotics for your daily dose.
I think that is in Australia different from in Europe.
Yeah.
So I have another opinion than in the UK.
Okay.
I think that we're coming to the end of our Okay. Yeah.
Hi, I have a 7-year-old with CF, so fairly early on, but I've always kind of had some, I guess, concerns where we're told from day dot, you know, high fat, high fat, high fat, doesn't matter what the fat is, do the high fat. And I did early on ask a very sensitive, lovely doctor, would there be implications later in life on doing, you know, going hard on that sort of diet early on? He nicely said to me, she won't survive long enough for that to be an issue. Not so helpful. But I did hear yesterday, I think it was Peter Stark, saying that there is he was commenting on the development of cholesterol issues for adults with CF. So I was just wondering if you had any thoughts around that.
Yeah. I disagree with your first answer of the doctor that it said it's not.
So did I, don't worry.
Yeah, because it's. I'm sorry. It's important that you also look at the kind of fat you use, because you are getting older, and hopefully very old. So you have also to look at your cholesterol and your lipid levels in your blood, and also when you have when you may have developed CFRD, it's also important to look at the kind of fat you take. So unsaturated fat has the preference instead of saturated fats. Okay? You can change your diet to use more unsaturated fats. Yeah. If there are any questions left, you can also send me an email. You can see my email on the slides, so I can answer your question later on. So I would like to thank you for your attention and your participation. It was a great honor to be here, and I wish you a nice conference. Thank you.